For perpendicular alignment to the tooth axis, the operator can position themselves on the patient's right side, or alternatively, the operator's body can be positioned on the left side. Especially in two-handed dentistry, where an assistant is absent, you can actively and creatively utilize the unoccupied left side space, precisely because no assistant is present. Even when using the perpendicular L mode, we can classify the section grasping into two distinct types, the grasping setting for the suction and the hooking setting. Let's delve into each category individually. First, we will examine the specific scenario of grasping in the perpendicular L mode. Starting from the incisal view, the operator's torso is positioned at the 3 o'clock direction. To secure the line of sight, the patient's head is rotated to the right. The operator's waist and neck are within the normal range. The left hand stabilizes against the right masseter with the 3rd, 4th, and 5th fingers, while grasping the suction with the 1st and 2nd fingers. The right hand is placed with the 4th finger resting on the anterior teeth, and the handpiece is gripped with a short hold. The secondary curve of the suction tip should be angled slightly toward the body, so the bulk of the suction tip doesn't interfere with the handpiece prepping tooth number 22. So, as we've reviewed up to this point, when performing a prep on the incisal of tooth number 22, it's feasible to utilize either the parallel mode, the perpendicular R mode, or the perpendicular L mode. From these various options, you are free to choose the specific approach that you find most suitable for yourself. However, in my opinion, the perpendicular R mode is somewhat inappropriate, especially when contrasted with the parallel mode and the perpendicular L mode. This is particularly true for prepping tooth number 22, and more specifically, the anterior teeth located on the left side within the 20 series. Therefore, when we use an instrument for a surgical procedure to access a specific tooth and a particular target area, there can be a wide array of options for the approach. It is certainly advantageous to have the wisdom to choose selectively the most appropriate one from among these numerous alternatives. Let's look at the prep for the buccal surface and mesial of tooth number 22, and the distal proximal surface approached from the buccal surface. The patient's neck still turns to the right. The operator is positioned at 3 o'clock, aligning in perpendicular L mode, perpendicular to the tooth axis. Operator's back and neck are normal. Left hand grasps the suction tube with fingers 1 and 2, resting 3, 4, and 5 on the right masseter. With your right hand, resting the 4th finger on the 10th position anterior teeth and holding the handpiece perpendicular to the buccal surface of the 22nd tooth, it will assist in the prep. As shown in the previous slide, when preparing the bucco-mesial and bucco-distal surfaces, there are 3 approaches available, not only the perpendicular L mode, but also the parallel mode and the perpendicular R mode. The perpendicular R mode can be considered disadvantageous for the bucco-distal prep in terms of securing visibility and establishing the operator's posture. So, we have the option to choose selectively from these 3 approaches, and there should be no need to pick the disadvantageous perpendicular R mode. Let me outline a general overarching principle here. Rather than concentrating on the elements of posture that resemble a plant's branches, like the arm, the wrist, your grip, and where you rest, you should first prioritize the patient's head, which forms the roots of the posture. And if you appropriately select higher-level posture elements, such as the operator's torso position, torso direction, and the lumbar area, which are akin to a plant's roots, then the lower-level posture elements, like the arms, shoulders, wrists, and fingers, can be assumed more comfortably and healthily, ensuring a better, more natural posture for the practitioner. Therefore, it's essential to know how to appropriately select the higher-level, more fundamental posture elements. When removing caries or performing a prep on the buccal surface or incisal edge, specifically in perpendicular L mode, there are 2 distinct types of handpiece grips that can be utilized. As you can see in the top photo, there is the handpiece alignment where the handpiece enters perpendicularly to the plane of the oral cavity, and in the bottom photo, this plane constitutes the oral cavity. Yes, there's a method where you align the handpiece nearly parallel to it. Both methods have pros and cons based on the target tooth and area. For instance, the method described above offers significantly greater stability and is more appropriate when prepping the axial wall because it allows the burr to be aligned parallel to the tooth axis. The method described below aligns the burr perpendicular to the tooth surface. This offers a distinct advantage for selectively removing facial caries, cervical region of tooth caries, or proximal surface caries. Let's look at the prep for the mesial and distal proximal surfaces approaching from the palatal side. In fact, for a prep on this specific target area, adopting a perpendicular L alignment mode for the posture is not particularly appropriate. This applies to the palatal, the palatomesial, and the palatodistal areas. For all three target areas, the perpendicular R mode enables a more optimal posture compared to the perpendicular L mode. If you visualize this, it becomes clear that gaining a good visual field in the L mode is comparatively more challenging than in the R mode. From this viewpoint, we can observe that the practitioner's posture becomes severely distorted because they are forcefully attempting to gain clear visibility and accessibility to the palatal surface of the 20 series teeth. Firstly, their lower back is bending unnaturally to the left. Secondly, the neck undergoes excessive forward flexion and also experiences lateral flexion to the left side. Also, to secure a clear line of sight, rotation to the right occurs. In short, it becomes severely distorted. Third, the right shoulder lifts upward and the arm tends to spread out, moving away from the body. Fourth, the angle at which the wrist is bent becomes excessive. Therefore, for the target area of tooth number 22, it is appropriate to use the perpendicular R mode, and I recommend referring to the corresponding slide. To reiterate, what we can learn from this is that when diagnosing or treating a specific target area on a specific target tooth, there are suitable and unsuitable posture modes. Therefore, the approach we choose to adopt is of utmost importance. When you adopt an inappropriate posture mode, as in this case, you lose the health and naturalness of your posture. The image on the left is an enlarged view of the posture from the preceding slide, illustrating significant left bending in the waist, causing the left shoulder to drop excessively and the right shoulder to rise too much. Because the right shoulder is excessively elevated, as a compensatory measure, the arm and armpit will consequently be raised and spread out laterally. You can clearly see how the armpit ends up spreading out like this. The right photo displays an arrow representing the actual line of sight for the practitioner, specifically when there is excessive forward flexion of the neck. This happens in order to achieve a clear view of the palatal surface on the maxilla. This illustrates how the angular difference between this visual perspective and the viewpoint of the recording camera significantly increases. I want to emphasize once more that the scene viewed through the practitioner's actual line of sight, represented by the red line, appears much clearer and less obstructed than the video footage captured from the camera's angle of view indicated by the yellow line. When posture is distorted, the difference between the camera's and your eye's line of sight will inevitably grow. Now, with all other conditions remaining consistent with the previous slide, let's explore the category of hooking the suction tube. I will focus on the differences from the grasping mode and move on. When doing a prep on the incisor, you hook the suction tube on the right side. Because the suction tube is already hooked, your left hand is now free. This allows you to perform temporary indirect view checks using mirror work at precisely the moments when they are needed. Additionally, you can typically assist in securing a clear view of the target area by gently pulling the obtrugate on the left side slightly outwards. The rest of the posture elements, the parts shown transparently now, are as in the previous slide. Let's watch the video and move on. This particular scene depicts an incisor prep. The prep posture for the buccal surface and the mesial and distal proximal surfaces approached from the buccal surface is identical in almost every element to the previous slide. We'll watch the video and then move on. Okay, let's take a look at the video. Prep distal proximal. Prepping the mesial proximal surface. Now, this is a case where the target areas are the palatomesial and palatodistal proximal surfaces under the different condition of hooking. Similar to the grasping mode, the perpendicular L mode itself is not an appropriate posture for performing a prep on this target area. It's recommended to perform the prep in the perpendicular I mode. I'll skip the reason why, as it was explained in the previous slide. Let's observe in this video precisely how one's posture can become severely distorted when an inappropriate posture is assumed. In this way, the neck will be in a state of forward flexion. And as the neck goes into forward flexion, the right shoulder and right elbow lift outwards. This is a less than ideal posture. So with this, we've explored various postures according to each target area and each alignment mode when performing preparations on the anterior teeth, specifically in the 20s range. Next up, we'll delve into the details of the premolar region.